Hi everyone, welcome back to this small tutorial on Glucagon from ilovepharmacology. So the human recombinant glucagon has got some specific action in clinical practice. Basically it elevates the blood glucose concentration and also it increases the rate and force of heart contraction. Mainly glucagon has been used to elevate the blood glucose level whenever the patient is hypoglycemic in nature, if the glucose dextrose are not working effectively. So basically they raise the blood sugar levels. How do they do? Coming to the mechanism of action, glucagon stimulates the G protein coupled receptor which are linked to GS type and activates the adenylate cyclase, which will going to elevate the blood glucose levels. How it does? It stimulates the activation of adenyl cyclase will stimulate the hepatic gluconeogenesis. It stimulates glycogenolysis, breakdown of the glycogen, and inhibits the glycogen synthesis. And also the action of glucagon mimics the action which is produced by adrenaline, which are activating the beta adrenoreceptors. They are basically a peptide hormone which must be given through injection. Peptides are not useful through oral route. Peptides has to be given through injectable route, and plasma half-life is around 5 minutes. So coming to the uses, so the glucagon is used as an emergency drug for the treatment of hypoglycemic emergency, which can be caused due to insulin overdose or when oral or IV glucose administration is not possible or not working. And heart failure precipitated by the alpha adrenoceptor antagonist. In such situations, you can use glucagon as it increases the rate and force of the contraction of the heart. So glucagon is useful in two conditions. One is in case of hypoglycemic emergencies due to insulin and the heart failure. Coming to the adverse effect profile, although it causes nausea as the side effect, so cardiac stimulation in patient taking beta blockers or with pheochromocytoma, you should be very careful. And the route of administration of glucagon is it can be administered through several routes, through intravenous bolus as well as infusion, also through intramuscular route, subcutaneous route, and intranasally as well. And the glucagon is available in the form of pre-filled glucagon injector, which has been received approval to inject glucagon into the patient's thigh. So whenever the patient is not responding to the glucose or the dextrose or the oral glucose or through IV glucose, the next step what you need to do to increase the blood glucose level in case of hypoglycemic attacks, you need to give a glucagon which mimics the activity similar to that of the adrenaline, which acts through beta receptors to increase the blood sugar levels. Thank you.